Picture the following situation. You enter the hospital. You describe your symptoms. You expect a human touch, but what if an AI, not a person, offers the most accurate diagnosis? Well, that scenario is not far off. Google's latest AI, AMIE, stands at the forefront of a medical revolution, allegedly outperforming human doctors in diagnostic accuracy. But what could this signify for your own health outcomes? Let's find out, folks. So Google's AI system, AMIE, Articulate Medical Intelligence Explorer, has been designed to revolutionize the way we diagnose medical conditions by enabling detailed conversations and diagnostic reasoning with patients. AMIE's training process involved rigorous self-play, where it acted out both the patient and the physician roles. This innovative method not only refined AMIE's diagnostic skill, but also enhanced its conversational abilities. The benefits of self-play learning are significant. AMIE rapidly assimilates vast amounts of medical knowledge, staying current with the latest research and case studies. This continuous learning loop ensures AMIE remains a cutting-edge tool in healthcare. When compared with primary care physicians, AMIE demonstrated superior diagnostic accuracy and maintained a level of empathy and understanding in patient interactions. So, considering the future implications of AI healthcare, systems like AMIE could dramatically increase access to medical expertise, particularly in underserved areas. By augmenting the work of healthcare professionals, AMIE promises to be a valuable ally in reducing medical errors and improving patient outcomes. Training and evaluating AMIE. Understanding AMIE's advanced capabilities underscores the importance of the rigorous training and evaluation process it underwent to achieve such diagnostic proficiency. AMIE's training involved sophisticated vision models and diverse evaluation techniques to simulate countless medical scenarios. You see, this extensive preparation was aimed not only to enhance AMIE's diagnostic abilities, but also to prioritize patient safety considerations. But not everything is sunshine and rainbows. You should be aware that despite its prowess, AMIE's learning journey acknowledged real-world limitations. Training data can't possibly cover every medical condition or conversational nuance, so the developers designed AMIE to learn from simulated interactions as well. However, it's true that this innovative approach expanded AMIE's exposure to a variety of medical dialogues, enhancing its adaptability and accuracy. Moreover, collaboration opportunities with healthcare professionals were essential in refining AMIE's performance. These partnerships facilitated a two-way knowledge transfer where AMIE's AI capabilities were fine-tuned with human expertise, and medical professionals gained insights into AI's potential role in healthcare. Ultimately, AMIE's evaluation wasn't just about outperforming human doctors in accuracy. It was a comprehensive assessment of its ability to serve empathetically and effectively, ensuring that its deployment would truly benefit those it's designed to assist. Self-play benefits for AI. Now, self-play has propelled AMIE's AI to new heights, enabling it to learn and refine its diagnostic skills through simulated medical dialogues. Well, who knew games could be so beneficial? But it's true. Continuous learning is at the heart of AMIE's development, ensuring that it keeps pace with the ever-evolving medical field. This means you can trust AMIE to stay updated with the latest medical knowledge and practices. The beauty of self-play lies in its scalability. AMIE can experience thousands of patient interactions without the need for actual patients, which is invaluable in a world where every second counts for those in need. The adaptation and updates that result from self-play ensure that AMIE's knowledge is constantly broadened and deepened, reflecting real-world complexity and diversity. Importantly, the diagnostic accuracy of AMIE is a testament to the effectiveness of self-play. It's not enough to converse. The conversation quality must be such that it elicits the right information to make accurate diagnoses. So when AMIE talks, it's with a clarity and precision that resonates with both empathy and expertise, serving the greater good by potentially saving lives through improved medical diagnostics. Comparative study design. To assess AMIE's capabilities against those of human doctors, researchers designed a randomized, double-blind study using actors as patients in simulated consultations. The researchers meticulously evaluated the AI performance, ensuring that patient satisfaction remained a priority throughout the process. However, it's important to recognize that the study had limitations. While AMIE's diagnostic prowess was remarkable, real-world conditions can vary greatly, and such simulations may not capture the full complexity of live patient interactions. And this is where humans come in, as our insight and empathy are irreplaceable components of patient care that AI is still striving to emulate. Future research directions should aim to bridge these gaps, enhancing AI's ability to support doctors in delivering exceptional care. By continuing to refine these tools, the potential for improved diagnostic accuracy and patient outcomes becomes a very, very tangible goal. AI's diagnostic superiority. So you might be thinking, how does AMIE, Google's AI system, achieve its remarkable diagnostic superiority over human doctors? By harnessing vast datasets and self-improvement algorithms, AMIE has been trained to evaluate symptoms and medical history with exceptional precision. This could be a true revolution in the field of medicine and in the healthcare space in general. But with this technological leap come ethical implications that we have to navigate pretty carefully. Can we really trust in an AI system to take care of our patients? Can AMIE build a rapport necessary to gain this trust? And how do healthcare providers ensure the AI's recommendations are sound? Reliability concerns are also at the forefront. AMIE's performance, while impressive, must be consistently monitored to prevent misdiagnoses that could have serious consequences. The global adoption of AI like AMIE could be transformative, providing underserved communities with expert-level consultations. Yet it's crucial to approach this adoption with a mindset of humility and service, recognizing that technology is an aid to human skill and never, ever a replacement. However, the commitment to serving patients ethically must guide the integration of these systems into healthcare, ensuring that as AMIE evolves, it does so with the goal of supporting and enhancing the sacred doctor-patient relationship. Conversational skills analysis. Amidst the landscape of medical innovation, Google's AI AMIE hasn't only excelled in diagnostic accuracy, but also in mastering the nuances of patient communication. We're keenly aware that patient satisfaction hinges on more than just clinical outcomes. It's also about the experience. AMIE's conversational skills are designed to foster trust and understanding, a core value in the mission to serve. However, you must consider the ethical implications of AI interactions. Patients have the right to know when they're speaking to an AI, and AMIE must respect patient autonomy and privacy. AI limitations currently prevent AMIE from fully replicating the warmth of human touch, yet future advancements aim to bridge this gap. And what about the costs? Enhanced efficiency and accuracy have the potential to reduce unnecessary procedures and misdiagnoses, which could translate to substantial savings. But we must tread carefully, ensuring that cost-cutting doesn't compromise care quality. As we all look to the horizon, we can see how AMIE's evolving capabilities may one day enhance our ability to serve patients. Until then, I think we should balance optimism with a commitment to ethical practice, always putting the patient first. Well, what do you guys think? Implications for healthcare. While considering the conversational prowess of AMIE, it's crucial to explore the broader implications this AI's capabilities have for healthcare delivery and patient care. The promise of enhanced patient outcomes can't be ignored. With AMIE's precision in diagnostics, you can anticipate a reduction in misdiagnoses and improved management of diseases, leading to better recovery rates and patient satisfaction. Incorporating AMIE into AI in medical education could revolutionize how future doctors are trained, providing them with an invaluable tool for learning and simulation before they even meet real patients. However, the ethical considerations must be at the forefront of this integration. As doctors strive to serve patients with the utmost care, ensuring that AI supports rather than replaces the human touch is absolutely vital. AMIE's capabilities also present an opportunity to expand global healthcare access. Imagine reaching underserved communities where medical expertise is scarce. AMIE could bridge this gap, offering high-quality consultation and advice. However, it's essential to approach this with a sensitivity to local needs and cultures. The future of AI in healthcare is bright, and with thoughtful application, it has the potential to transform lives. Okay, so final thoughts on this. I guess you thought your doctor's seasoned intuition was irreplaceable. Well, now that Amy's here, some of our best practitioners are going to be left in the digital dust. That's progress, right? In any case, would you bet your money on doctors being replaced by machines anytime soon? Let us know in the comments, and drop an AMIE in the comments to let us know you watched the whole video. And of course, if you like our content, don't forget to like the video and subscribe for more info on the latest AI news. See you in the next one, folks. You take care.